joined us for today's webinar. On the call today, amongst the many participants, we have representatives from our 3 state teams, the first being the Kentucky Division of Family Support. The second is a team from Georgia's Division of Family and Child Services. And the third is a team from South Carolina's Waccamaw Economic Opportunity Council. Along with our other cohort partners that I just wanted to thank for joining us today, we have Rosa Maria Castaneda and Juanique Foulard from the Annie E. Casey Foundation, who have provided some of the support for this work. Jeff Fredericks, our partner from Administration for Children and Families Region 4, as well as Ann Flagg from APHSA. Just a few notes before we get started. Would ask that everybody please mute themselves on the line. I think that's the case, but thanks to all of you for doing that. Second, wanted to let everyone know that we will be recording this webinar today and posting it so that you can review it after the webinar and share it with others on your team. We'll also be able to share the slides for reference after the webinar. And also ask that over the course of the time together today, that you send any questions that you have for us through the chat box that's available on your screen. We hope to have some time for question and answer at the end of the conversation, but we will also keep an eye and try to address any questions that pop up along the way. Next slide. So with that, I think most folks have met me, but if not, my name is Layla Goldberg. I'm a director here at Third Sector. I'm joined by 2 of my colleagues on our team, Miranda Began and Joelle Straker. They're leading the work of this cohort, along with the rest of our team here. And we're so grateful to be joined in our office today by one of our local partners. We have Kamaria Moore-Hollis. She's the Economic Mobility Manager with the Employment Services Program at the Massachusetts Department of Transitional Assistance. So welcome again, and thank you for being here. So given that the state teams in this cohort are focused on both the needs of young parents as well as setting their children up for a strong start, we decided to focus our time today in this first webinar of the cohort by reviewing the 2-gen approach. So that's where we're going to start. The goal will really be to give each of the teams a starting point as you think about the whole family's needs when identifying the specific outcomes you are trying to achieve for the parents you serve through your programs and through your partnerships. We're thrilled to have Kamaria with us to share a specific example of how the Department of Transitional Assistance here in Massachusetts updated their Young Parents program to better meet the needs of their clients. At the end of the webinar, we'll share a 1-page worksheet that you can use with your teams to reflect on the conversation today and identify ways to apply learnings and insights to your specific local efforts. So how will we use the next hour? For those who may not be as familiar, I'll start with a brief overview of Third Sector and the cohort goals, and then I'll turn it over to Joelle, who will provide context on the 2-gen approach as it relates to young parents. Then Miranda and Kamaria will walk us through the case study from DTA's Young Parents program, and we'll end by reviewing the worksheet to help with your next steps. Great. So for those who may not know, and as a refresher to the rest of you, Third Sector is a nonprofit that provides support to state, county, and community-level agencies to implement systems change by linking public funding to clear outcomes goals. To date, we have worked with dozens of communities across the U.S. and seek out opportunities to have our partners that are focused on similar populations or outcome goals to directly share their lessons and learnings with each other as they do this work. We have found that the multi-site cohort model has facilitated this in previous efforts and look forward to building this regional cohort with a focus on young parents in the Southeast. As you may know, several states in the Southeast have the highest numbers of young parents nationally. In the 8 states in ACF Region 4, there are over 650,000 young parents with over 800,000 children. Young parents often struggle to juggle multiple priorities and responsibilities, including education, employment, and raising a family. And more often than not, public programs, policies, and systems are not designed to effectively meet their needs. This cohort aims to improve outcomes for young parent families with each of the teams focused on the following goals. First, to foster cross-agency alignment on shared goals and work together to use data and common metrics to measure progress towards those goals. They're also working to strengthen the continuum of services to help young parents achieve their goals, including improving wraparound supports that enhance parents' abilities to support their young children. Finally, we hope that by June and beyond, we can begin to synthesize what the various teams are learning to develop recommendations that can be shared with other organizations seeking to better support the young families in their communities. Given that many of the challenges that families face are due to the lack of coordination and alignment between four systems levers that shape how programs meet the families they are intended to serve, and these are here on the left side of the slide: policy, dollars, data, and services. Each team will be working to identify existing gaps between these four levers with the goal of establishing programs that more effectively meet the needs of young families, more coordinated policies and supports across agencies, and identifying ways to better use existing data to both understand family needs and measure impact of programs over time. The goal is that these efforts will result in stronger opportunity pathways for young parents and their children. Now I'll hand it over to Joelle to talk more specifically about the 2-gen approach and examples of the system barriers that can be addressed by adopting a 2-gen lens. Joelle.
Thanks, Leila. In this section of the webinar, I'm going to define what is the 2-gen approach, highlight some opportunities for using that approach to better support young parent families, and identify a few key strategies for doing so. Now, what is the 2-gen approach? In a nutshell, the 2-gen approach is what it sounds like. It is an approach to programming that meets the needs and provides services for both parents and families simultaneously. These services are holistic and supportive of building the well-being of the whole family. 2-gen approaches represent a shift from the traditional or current approach to service delivery, where stakeholders, usually government and service providers, operate in silos. Programs are disconnected. Delivery is targeted at an individual unit of the family, either the parent or the child, using prescriptive case management, and parent outcomes are not connected to child outcomes and vice versa. The 2-gen approach to programming intentionally lands on a spectrum between the parent and the child, depending on who is the primary focus of the program or service. Under the 2-gen approach, stakeholders collaborate strategically. Case management focuses on the whole family. Programs and services attend to their holistic needs, with program enrollment being simplified and access being more efficient. And parent outcomes advance child outcomes, and vice versa. In line with the goals of the cohort, which are grounded in the 2-gen approach and focused on improving outcomes for whole families, the 2-gen approach offers specific opportunities for agencies in the cohort to enhance and align services to better support young parents and families. These opportunities are really interrelated and tie back to the framework or key pillars Leila highlighted earlier. The opportunities surround policy, dollars, services, and data. In terms of policy, young parents and their families, like their older counterparts, face several challenges, such as complex eligibility criteria, demanding application processes and procedures, and issues such as the benefits cliff, which are all rooted in policy. The 2-gen approach offers opportunities to advance policies that promote long-term self-sufficiency instead of short-term survival, using both data and stakeholder collaboration to inform and support that process. As for dollars, funding is often directed at services which are targeted at members of the family and are not always tied to outcomes that really matter for the sustainability and independence of young families. From a 2-gen perspective, flexibility in the use of program funding and the ability to blend and braid funding to support whole family needs and outcomes is key to delivering the supports needed for young families to succeed. In terms of services, A two-gen approach offers opportunities to enhance services in ways that contemplate whole family needs with streamlined access, personalized case management, and predictable and consistent engagement of families. These service-related opportunities better meet the needs of young parents where they are, allowing, for example, a parent to pursue academic credentials while the child receives quality childcare. Finally, in terms of data, what currently takes place is a lack of integration of data within and across agencies. This results in, among other things, enrollment barriers, a limited picture of the family and their needs, as well as a lack of understanding of the program and the impact of the programs that they are accessing. A two-gen approach offers opportunities to leverage data in a robust, active, and ongoing way to address those issues, provide for a better understanding of young parent families and how to better support their success. In terms of the strategies that could be used, how might we leverage the opportunities highlighted on the last slide to advance better outcomes for young parent families? Third sector helps states and provider agencies implement strategies to put those opportunities to work for the populations they serve. For young parent families, we want to emphasize three key strategies: engagement, measurable goals, and coordination. Firstly, in terms of engagement, given the unique challenges and opportunities faced by young parent families, it is important for state and provider organizations to establish mechanisms to engage with and elevate young parent voices in a real and sustained way to make sure that services are reaching and supporting them in an effective and impactful manner. Secondly, in terms of coordination, supporting the holistic needs of whole families in ways that advance their self-sufficiency requires states and providers to collaborate with one another and set up systems for coordinated services with easy and efficient access. And finally, establishing common goals. Once state and provider agencies are actively engaging with young parents and there is coordination across services, it is then important to establish measurable goals with data sharing and evaluation systems to support that are shared across agencies and focus on moving families to self-sufficiency with some level of shared understanding of what success would look like. I'll now turn it back to Leila to move us on.
Great, thank you so much, Joelle. Thanks for the overview of the two-gen approach and the specific opportunities across the four levers for advancing two-gen goals. And thanks also on that last slide for highlighting the strategies that states and provider agencies can leverage to advance better outcomes for young parents and their children. I would say that depending on where each team is starting, they might begin to address each of those in a different way or be starting in a different place, but all working towards those same overall strategy goals. I'll turn it over to Miranda now to lead a discussion with Kamaria about the DTA experience doing this work in Massachusetts Young Parents Program.
Great, thank you, Leila. So what I will talk through now is one specific example of implementing some of these different strategies that Joelle and Leila have introduced. And I think Leila's point around there being a different starting place for every agency and every service delivery partner is really important because there's a lot of different ways to improve two-gen outcomes and really better support whole families. And what we'll talk through today is the approach that the Massachusetts Department of Transitional Assistance took as an example of where you could get started, but know that this isn't the starting place for everyone. So we've been engaged with Massachusetts Department of Transitional Assistance for a couple of years now, third sector, and what I'll talk through now is what we specifically have done in partnership with DTA around their Young Parents Program. And so what we got connected with DTA on initially was kind of a conversation that started after the agency kind of looked at their data and saw that around 45% of the Employment Services Program participants as adults had been on TANF or TAFDC in Massachusetts growing up. And so that really flagged for the agency leadership that they we're not addressing the generational poverty cycle. And so that was really the motivation for kind of making changes and thinking about how to bring in a 2-gen lens in a more strategic way. And so what they did is they took advantage of an upcoming procurement that they had for their Young Parents Program, which is one of their kind of employment services programs for individuals who are receiving TANF or TAFDC, to really pilot some different strategies to advance 2-gen outcomes through that contract. And so just to give some more context on what the Young Parents Program is, it's a workforce training and education program for TAFDC recipients ages 14 to 24, most of whom who are disconnected from education or do not have a high school diploma, who are pregnant or parenting. And the services offered are really kind of within the realm of education and employment, as well as parenting programming, which is done through kind of other collaborative partners. And really the strategy that they zoomed in on was kind of how can we connect funding better to the 2-gen outcomes that we're really focused on as an agency. And so if we're kind of looking at those three strategies that Joelle introduced us to, the first step that they took as an agency was determining what those measurable goals for parents and children were. And so they worked to define what 2-gen outcomes were really most important to their agency, and really worked to develop incentives to improve data sharing and improve services to really kind of support service providers in doing whatever was needed to get to those outcomes. And so the ones that they ended up focusing on were education outcomes, looking at things like educational functioning level, and the achievement of a high school diploma or a GED, enrollment in a certificate program, as well as looking at personal and parenting goal attainment, and really starting to track data on whether those outcomes were being achieved and what those looked like, to better support the government and the provider's ability to see how those were progressing. And so that was really their step one. But then looking at some of the other strategies, once the contract was developed and providers and DTA were starting to track and really look closely at these outcomes, some of these other pieces came into play as well. So engagement with young parents and families has really at this point looked like engagement with the young parent providers, and really trying to understand what they're seeing on the ground and what the experience maybe has been, how it maybe has looked different for the parents and families that they're working with. And I know there's been some kind of broader agency-wide engagement with the ESP participants as well, to kind of inform some policy changes, which I know Kamaria will touch on briefly as well. And then I think another piece is really thinking about kind of building the infrastructure for young parents, and that's really looking at co-case management and really ensuring that services are coordinated across, the folks who are kind of working and administering the benefits, and those folks who are, working with them to participate in an education program or ensure that they complete a certificate, making sure that all of these different stakeholders are kind of talking to one another and looking at the same data and really actively co-case managing these young families. And so that's been sort of the capacity building that has resulted after the initial contract development, to really ensure that those measurable goals for parents and children that were defined can actually be achieved. And so with that, I will shift now to talk to Kamaria more specifically, as I know you'll want to hear from her how it actually looked on the ground, to talk a little bit more. So if you want to just start off by telling us a little bit about who you are and your role at DTA.
Sure. So good morning, everyone, or good afternoon. Thank you for the intro. So my name is Kamaria Morales. I have been with the Department of Transitional Assistance for about 5.5 years, and I am the Economic Mobility Manager in our Employment Services unit. So I oversee a series of employment services that we have. So we contract out with local community-based providers, and they provide these services for our clients. So I oversee a series of those, including our Young Parent Program.
Thanks, Kamaria. So I know I touched a little bit on that sort of 45% number and looking at the intergenerational poverty cycle, but would love to hear a little bit from you, what you saw as the motivation to change the YPP program.
Yeah, so I think it definitely started with that data, but I also think we were coming out of a very compliance driven cycle. We had just done a business process redesign for our SNAP unit. So the agency was very SNAP customer service focused, and we kind of lost sight a little bit of the actual quality engagement with our clients. And I think that I'll talk a little bit about her more a little later, but we had an associate commissioner come on, Amy Kershaw, and she was really the person who spearheaded this change. And she always says she thinks she was at DTA for like 3 months before she even heard somebody mention the word child. So that was definitely her push, really, was to figure out a way that we could get better outcomes for both our parents and for our children, so that, or for their children, so that we can see this 45% number decline at some point. So she had kind of this idea for the change, but we also were presented with the opportunity to re-procure our young parent program. It hadn't been re-procured in 10 years, so it was very heavily compliance focused. It was very focused on compliance with the participation hours. You had to be in a seat. It didn't really take into account different learning styles or the challenges that all of our clients face. So we really wanted to take a fresh eye at that program and see if we could kind of start instituting some of these changes here and with our providers, as our providers are the ones who are really seeing our clients the most often. So we went through this whole procurement, took us about a year, and the main focuses that we came up with were, we really wanted the work that was being done to be client-centered. So however providers were getting the outcomes for the clients, it wasn't up to the department to police that. If the provider was getting the outcome necessary, how that was happening needed to be left up to the client. So we really wanted to focus all of our work into making sure the work that was being done was client-centered, and we wanted to pay for those outcomes. So we wanted to, you know, as Miranda was saying, we wanted to incentivize quality work with outcomes. So as long as the provider was getting the client to the outcome that we wanted, we were able to pay them for that. And we wanted to make sure that any kind of workforce pipelines that were done were in line with high demand work. So there were actual quality jobs that folks were getting into, and they were able to obtain and maintain employment in there. The Young Parent Program is a little bit different in that our main focus is on education. So as far as the outcomes we're looking for those to be quality education based. We do have other ESP programs that focus on employment as well. And there certainly could be a pipeline from an education program to an employment program.
Thanks, Kamaria. That was a really helpful overview, and we'll dig into some of those kind of key components and key changes and some of the upcoming slides as well. But before we get there, would love to hear a little bit more about kind of who the work group was and who was engaged in this process of redefining the YPP program.
Sure. So like I said, Amy was definitely kind of the champion of this work. Amy Kershaw at the time was the associate commissioner. I don't remember the rest of her title, but she was one of our associate commissioners who one of her many responsibilities was overseeing the employment services program. And we had the commissioner of DTA, who was Jeff McHugh, who was very open to allowing us to try new things and allowing us to fail. He was very interested in employment service programs and how they would impact the economic mobility of our clients. So that was huge for us, and just having leaders who allowed us to try new things. So like I said, Amy was she spearheaded this whole effort. When we took on the procurement, it was a combination of the executive management as well as the employment services team, as well as our budget team. And we had minimal involvement from our actual contract managers, who were the folks on the ground who are managing these relationships. And I think that's probably something that we'd like to change.
Yeah, lesson learned.
Yeah, lesson learned. And I think moving forward, we did another procurement right after our Young Parent Program, and I think we took some lessons from there. So those are the folks that were mainly involved in that change, and that change spearheaded so much of the direction of the agency that when Commissioner McHugh left for a different opportunity, Amy Kershaw was promoted to the Commissioner of DTA. So now we continue to have a champion, even more so for the work that's being done in the Employment Services Unit.
Thanks, Kamaria. So, I know you started to talk about some of these changes, and I think flexibility in the approach and really making sure that the focus was on kind of the end results or the outcomes that you all prioritized was definitely a big change. But I would love to hear a little bit more about kind of what those changes looked like and how you felt like it was different for the ESP providers and the YPP providers specifically.
Sure. So it was before we did this procurement, everything was very tied to participation and making sure we met the federal participation rate, making sure folks were engaged in a program where they were seated either 20 or 30 hours based on really just the age of their children. So it really had nothing to do with their educational goals or employment goals. It was really just based on their eligibility for programming. And so the providers met that level. And so we really wanted, like I said, we really wanted to make it so that the providers were really working to make sure that they were working towards the client goals and not trying to maximize the amount of funding that they were able to get from the government. The participation can look differently versus provider versus client. So we have a couple of providers who work with a very specialized high-risk population. They're not going to sit in the classroom for 30 hours a week. So their schedule caters to what the young parent is looking to do. One day maybe where they're out in the community, one day maybe going to doctor's appointments, one day maybe working on a goal for their child. So we were able to bring in some non-traditional providers who were able to work with some of our clients who have a few more challenges. And the providers were able to be a little bit more flexible, and they didn't have to meet this kind of overall participation requirement. They were able to provide as much flexibility as possible for the client so that they can meet these outcomes, because we know that young parents aren't necessarily just going to sail through any kind of programming. There are going to be bumps on the road, and this flexibility allows for the providers to kind of work with the clients through that. We also have a dedicated workforce at the department. So they are self-sufficiency specialists, and they were part of the original welfare reform package, and they've gone through a bunch of different transitions, but most recently they have been dedicated specifically to working with our 14 to 24-year-old parents. So we try to make every effort for these workers to work with these clients from intake or as soon as their case is opened. These are the folks that we strongly encourage co-case management with the providers, not only for our young parent program, but for our teen parent shelters that we have. They're allowed to actually go on site, meet clients where they're at, do whatever kind of engagement work that needs to be done to make sure that the clients are reaching the outcome.
Great. Thank you, Kamari. I think it's really helpful to hear about how the flexibility enables there to be kind of a more targeted focus on this population, both in co-case management by really leveraging the self-sufficiency specialists and building up their capacity, as well as enabling providers that maybe wouldn't have traditionally been able to apply as a sort of a way to address some of the barriers that maybe more specialized populations would face in a more traditional YPP program. Yeah. And I think it would be helpful to hear a little bit about kind of how the structure of the contract actually enabled that to happen as you rolled out that change.
Sure. So essentially, our contracts, before there were several different payment points. We did have employment also as one of those payment points, but there was no regard for the quality of the employment. So right now we really only have 2 different payment points for young parent programs. We will pay for an enrollment into the program, and we will pay the same dollar amount for any individual outcome that folks achieve when they're in there. So however, like I said, however the provider gets to these outcomes, we will pay for. But I think that freeing that up a little bit has increased the flexibility for the programs, and I think the fact that we're kind of reimbursing for these outcomes kind of encourages folks to try their best to making sure that their clients are getting these outcomes so that they can continue to receive funding and be able to operate their programs. I think that when we worked in the procurement team, there was a lot of pushback on this, and I think Amy was kind of like, well, if they're going to enroll people, we'll pay them for an outcome. So however they, we're not going to pay them unless they do the job. So however they get that done, that's not really our concern. So if they're getting a person a high set and they were only in that seat 1 day a week for 3 months, that's not really our concern. They got the person a high set. So that's kind of an overall overview of how the funding helps to increase the flexibility for the program.
Yeah, and I think something I would add here too is that the way it was structured, it was actually more money for the providers than they were previously receiving, right?
Yeah, so we were able to increase the dollar amount that we were giving them for both the enrollment payments and the outcome payments, which is definitely attractive. I mean, it's not a whole bunch of money, but more money is always going to be more attractive to the providers. So.
Great. We'll continue with the questions, but I just wanted to pause and remind folks that there's a Q&A chat box. If you have any questions that come up as we go through these, feel free to drop them in there, or if you're just writing them down, we'll also have space for them at the end. So definitely keep tabs on those questions as they come up for you all. Great. So, I think, one of the things that you talked a little bit about was that kind of co-case management and the focus of the self-sufficiency specialist. It would be great to hear a little bit more about how that role has actually looked different and kind of what that specifically enables the young parents to kind of have access to as a result of having someone who's specialized and focused on them.
Yeah, so that role, like I said, it has gone through a lot of transition, and I think we did this kind of a little bit backwards. We sent the young parent program out first and then kind of did all the maintenance work behind the scenes. So we worked to specialize this role after the young parent program had been already rolled out, in realizing that if we were going to have this kind of new flexible lifestyle for the YPP programs, we needed kind of consistent engagement on the ground from our staff, from our workers, and from our contract managers. So as far as the self-sufficiency specialists go, we created new guidance, new job descriptions for them. We increased their caseload. They originally had a smaller caseload, but we increased their caseload to, I'm not going to quote the number because it changes often, but we increased their caseload so that they could meet the needs of the office. Not every office is going to have as many young parents as the caseload would allow, so sometimes it is padded with other folks. So we incorporated the co-case management into their specific job duties and their responsibilities. We ask them to go to the different sites that they share clients with at least once a month. It can look very different in different offices. We have some offices in our larger metropolitan areas that have maybe 6 self-sufficiency specialists, and it's one of the challenges we've come up with. I know that's the next question, but one of the challenges we've come up with is kind of balancing the desire to engage our young parents on a quality level with balancing the needs of running a TAFDC office. So that's one of the things that we struggle with and continue to struggle with. But I think the idea behind the co-case management was really that the young parents were setting goals with someone, and that someone was kind of helping them follow through on their goals, helping them to address any kind of challenges or barriers that were coming up, supporting them, coaching them, mentoring them, making sure that they were continuing on. And they were also working with the provider, they were working with teen shelter if they were there. Kind of everybody was on the same page and supporting this client to further along on their economic mobility journey.
Great. Yeah, so I mean, I know you started to touch on some of those challenges, and I know we've been working together both on this YPP program as well as another ESP program that they've transitioned. So I know we've talked about a lot of these extensively, but would love to hear you share some of the biggest ones that have come up.
Sure. So like I was just saying, it's an adjustment, to get folks. And from the management of the office down to supervisors, to kind of get folks on board with this change and engagement. I think not everybody is as comfortable with the flexibility as we were when we were kind of creating this program. I think folks have for so long been tied to this compliance and the participation that it's hard for them to just let folks go and not necessarily have a very specific idea of what their schedule is. I think the way that we messaged. Maybe, I think we messaged directly to our self-sufficiency specialists and maybe not from the top down. So I think they often feel caught in the middle, like, well, my office is telling me I need to be here, but you're telling me that I need to be out in the field. So we're working on that. I mean, I think we just have to continue pushing the message. We have another specialized role, staff role at DTA, and I think that it just took the same amount of work, just consistently pushing the message, trying different ways to make sure everyone's on board. So that's one of the challenges that we've had. I think the same thing with our providers too. I think we may have been a little more ahead as far as like believing in the flexibility of the providers, even more than the providers did. I think some of them felt a little wary. Like, I think honestly it was just like, I don't want to do anything wrong. I don't want to get anybody in trouble. And this flexibility, I'm not used to having this flexibility. I'm used to being compliant. I'm used to following the rules, instead of I'm used to doing what's best for the client. So that's, you know, we have different avenues where we continue to work with our providers. We have quarterly learning labs where we work with them. We're always trying to provide them different resources that they, you know, so they can continue to be a part of this change as much as possible. I think that we, you know, whenever you have a new program, there's always some kind of administrative burden that comes along with it. I think, you know, we were lucky to have, we had a couple of contract managers. This program is smaller than the other one that their sector is working on. So we have a smaller staff overseeing it. So we were able to kind of get a hold on that administrative burden. But I think I was brought in to oversee the Young Parent Program after the contracts were already rolled out. So I think there wasn't a lot of support for the contract managers when the contract first came out. So I know that they would say that administrative burden was probably a huge challenge for them. And then, you know, the data is always was one of the most important things to kind of enrolling and engaging folks into the program. And we don't have the best handle on that. I think we're just now getting some kind of concrete data dashboards that we can use to access, but I think we're still on a learning curve with teaching folks how to use it, what the best way to monitor it is, how do you engage the providers in using it. So I think we're still kind of, like I said, going through a learning curve with all of these things.
Yeah. Yeah, and I know the data piece is a challenge for, I'm sure, many of the folks on the line, and, you know, would love to hear a little bit about how you all kind of made it work with the limited data that you had, because I know that's a question on people's minds.
Yeah, I mean, I think I don't know that we have perfected making it work. I think that we kind of looked at what we have. We looked at what we have in our own caseload data and used that to support encouraging kind of enrollment and referrals into the program. I think there's still room for training and room for growth around how our contract managers use it and how they share it with providers, because I think there's a bit of a discrepancy there with like the data that we have versus data we're able to give to providers. So I think there's definitely still room for growth there. I mean, I think we're honestly still in the weeds with it. I think we have these dashboards. There's different dashboards for different specialties and for our sanctions, for our caseloads, for our referrals. So I think we're just now kind of getting organized around the data, and now our next kind of step on learning is really focusing in on what's the best way to use it to increase folks engaging in our employment service programs.
Right. Yeah, and for kind of outcomes tracking for YPP, you all sort of use it's based on provider reported data at this point in time, right? But
correct, yeah.
Not the long-term plan.
No, and it's all, you know, our YPP billing is still, for all the work that we've done, the administrative part of it is still pretty stone age. We're still using paper billing for it. So yeah, and it is provider reported for all of that stuff. So we're looking at some different avenues to improve that, but to be continued on that.
Thanks. Thank you. So I guess my last big question before you know, we open it up, and you know, we've got lots of time for additional questions that folks may have, is really just thinking about, you know, knowing where you all were 2 years ago when you were just starting this process of like, okay, what is 2Gen? How do we bring it into our young parent program? Like, what does that look like? What advice you would give to the different government agency folks and other community partners on the line as to where to begin and you know, what to keep in mind?
Yeah, I mean, I think definitely like identifying the champions that you have in your agency and the folks who are not only champions, but hopefully those are champions that have the power and capacity to kind of make moves on your behalf. I think I think having that will take you a long way. And then I think bringing in everyone's voice first before you kind of make any changes. I think there's a balance there. I think, you can hear everybody's voice until you're kind of blue in the face and then you don't make any change. But I think there's definitely value to hearing where everybody's at with this change, because I think we moved forward because we had the opportunity. I think it was the right thing to do, but I think we're doing a lot of catch up after the contract has been issued. So I think however you can bring in your staff voice, your field staff, your contract management staff, the providers that are working with your clients, your actual clients, any stakeholders who would be involved, I would definitely encourage bringing those folks in immediately, and making sure kind of everybody's on board with the mission before you move forward with it.
Great. Yeah, and then I think, obviously there's been an iterative approach as we've moved beyond it, and just thinking about how you've worked to build that mindset within the different staff and the different stakeholders, because I know sometimes that can feel like a lot.
Yeah.
It's like, oh, you're changing this, and then you're going to change it 3 months later because
Yeah.
you heard this. Like, what does
Yeah,
that look like?
I think it just, I think getting folks involved first just gets you that buy-in first. I mean, not everybody's going to be on board, but I think, I think if they're going to be a little bit more likely to provide the buy-in if you're at least trying to gauge how the change will affect them at some point. We recently had a large policy change with DTA where we've done a lot of kind of change initiatives, but we stopped our family cap rule that we have in Massachusetts, where we weren't paying for the entire family size for the benefit, and our previous commissioner, Jeff McHugh, would just kind of go around and walk to local offices and ask folks, like, what do you think about this family cap change? Some folks would, be very much on board for it. Other folks were very much against it, and these were DTA workers that we had. But I think we were able to, that there was a huge administrative burden with that. We were able to get that done very, very quickly. And I think just kind of getting that buy-in from folks, just casual buy-in, helps to get everybody to support that. So I think, this is a huge change. We're 2 years in, but we're not anywhere near done with the amount of change that needs to be done. I think some staff will kind of hop on board, some staff will not. But I just think as long as you're continuously, gauging the voice of the people that actually have to be doing this and allowing a space for them to offer their opinions, I think that might have helped us in some of the bumps that we had. We done that first. Yeah.
Thank you, Liz. Thank you, Kamaria. At this point, I would love to open it up to other questions that folks may have. I don't believe I saw anything in the chat box, but yeah, I'll turn it over to Layla, who will ask a couple of the questions.
I had a couple of questions, Kamaria, when you were talking. The first one, as you were talking a little bit more about the role of engaging providers and hearing, from them about the needs of families. Curious to hear a little bit more about the quarterly learning labs with providers, both in terms of how you help them learn from each other and how you use those to inform the way the agency thinks about the program.
Sure. So we actually took that idea from another employment service program that we inherited from another state agency. They had been doing these quarterly learning labs. So we utilize them for a couple of different things. We utilize them to kind of just share information about the department, but we also use them for working groups with each other. So trying to get them to learn best practices from each other. One of the things we're talking about recently is like specialized orientations and ways to kind of engage our young parents. Not to get kind of too into the weeds, but a lot of our young parents don't have a work program requirement, so they don't necessarily have to be participating in anything. So we're trying to get creative around how we can get these folks to utilize their time clock as best as possible. So we are planning on having our next learning lab where we have some of our providers who have shown to be really good at that, share some of the work that they're doing to kind of encourage the other folks to learn from them. We also occasionally will combine that learning lab, we'll combine our providers with our self-sufficiency specialists, so they'll come together. They'll also, you know, this next one that we have coming up, they're going to talk about kind of the different ways to present these specialized orientations. So it's not just kind of reading from a PowerPoint, it's like engaging the clients and figuring out the best way to get those folks on board. So it's really just an opportunity for folks to learn best practices from each other. And we have all the providers statewide come to them.
Mm-hmm. So. And just my other question was actually about the providers themselves. I know in one of the questions that Miranda asked about, you know, how families are now served differently as a result of some of the changes. And I know you touched briefly on the ability to be able to involve more non-traditional providers to serve some of the specific needs that families have. Can you talk about some examples of who those providers are?
Sure. So here in Massachusetts, we have an agency called ROCA, and they work specifically with what they call them, like the most high risk. They always tell us, like, if you have a client who's, you know, interested in engaging, wants to participate, then ROCA is not the place for them. They want to work with folks who are not interested, who don't show up. They call them very high risk. So there's never really been a place for them because it was so kind of structured and prescribed before. So they have come on as one of our new providers. UTech is another one. They work with a very similar population in the northern part of the state, northern region of the state. More Than Words is a social enterprise that we have here in Boston, where they are also working with very high-risk youth, and they are owning and operating a bookstore in Boston. It's a $4 million business. I mean, they have jobs, they get paid, so it teaches them a very a different skill set that maybe a traditional YPP program would not work for them. So those are just those are some of the newer providers that would not have been able to participate previously.
Those are really good examples.
Yeah.
Yeah.
And then I guess just building off of that question, and then I know I see one in the chat box, and we'll jump to that next. You know, specifically looking at the populations that are served by some of those non-traditional providers, how do you think that has influenced maybe resolving some potential equity gaps or, you know, challenges there with the traditional providers?
I think that, you know, I think before we just weren't able to, you know, it's not that these particular clients didn't have any economic mobility goals, we just didn't have an avenue for them. So I think just allowing the space for non-traditional providers just allows more folks to find non-traditional ways to achieve whatever their goals are. So I think that kind of decreases the equity gap because there's more space for folks who maybe weren't able to participate before.
Yeah, that's great. Thank you. So one of the questions I see here in the chat box is around the child welfare side of the house, and just wondering how you engaged and collaborated with the Child Welfare Agency, if at all.
So I'm assuming that would be our DCF, the Child Welfare.
Yeah, exactly.
So the teen parent program that I spoke about earlier, DCF actually operates that program. We are just in a partnership with them where we provide the funds, and DCF actually operates the program. So that's one of the programs that I oversee, so I work very closely with those particular staff. Those two staff, too, work very closely with our self-sufficiency specialist. So that's kind of a niche part of DCF, but that part we do work very closely with. They weren't very involved in the actual procurement of the Young Parent program, but they are re-procuring their the kind of overall grant that their teen parent program falls under. And I think that we're going to take an active part in participating in that as well.
Other questions? Feel free to drop them in the chat box.
Maria, I'm happy to walk through the worksheet if we're waiting for any other questions.
Sure. Yeah, we can do that.
So first of all, just wanted to thank you, Kamaria, for walking through all of that. I know I learned a lot by just listening to you, share the experience that you all had. So thank you again for taking the time to walk through all those details with us. Before we wrapped up, we wanted to take a moment to talk a bit about next steps, especially for the project teams. From this,
I have a question.
Oh, is there one there?
Yeah, they just wanted to actually ask the question.
Oh, great.
Hi, is the Waccamaw group? I think I unmuted you. You should be able to ask your question now. Is there someone from the South Carolina team that's trying to ask a question?
Can you hear
Yes, we can hear you.
me now?
Yes. You can feel free to ask your question.
Hello?
Yes. Hi, we're here.
Can you hear me? Okay. And what has been the success rate with the participants meeting their identified goal or outcome?
So as far as the success rate goes for young parents, we're in the second year. I think our first year we did not have a high rate of outcomes and I think that was kind of by design. I think one of the things that we thought about in our procurement was extending the time that folks were able to participate in the program. So now that we're in our second year, and I'm sorry, I don't have any specific numbers for you, but we're seeing a lot more higher percentage of performance in the outcomes. So I think we're definitely seeing folks, especially in their progress towards their HiSET and their GEDs. We're seeing a lot of outcomes around the educational functioning levels, kind of getting a little bit closer to that. So we're definitely seeing a higher rate of outcomes being completed in our second year.
Great, and I just pulled up a slide that kind of has some of the initial takeaways that we heard. So after the first year of the rollout of this program, we actually had some focus groups with the YPP providers to kind of speak a little bit about what they were seeing. And, some of these quotes here just sort of indicate that trend that Kamaria spoke to, having more participants than ever, completing their high school equivalency, really thinking about the broader achievements too that the folks have been able to make. And I think that's been a question that we've had around potentially expanding the outcome payments, acknowledging that, some of these folks are, been able to get into stable housing successfully for the first time in many years, and that being a huge success. And really that's, an initial step to being able to be on that economic self-sufficiency path. And so I think there's a lot of conversations now around how can we potentially reward providers or support providers and rewarding them and congratulating them for that, other aspect of a job well done before, maybe even a HiSET is achieved, for example. So that's some of the conversations we're having. Would you want to add anything to that?
No, I mean, I think you're right in that, our focus on the incentivized outcomes is really on kind of the tangible outcomes of education goals. But I think we're really interested now that we're almost 2 full years completed, on expanding to some of the parenting and family outcomes that we have. We have them specified in the contracts, but we don't have a mechanism to really incentivize them. And I think we're really interested in pursuing that.
Great, thank you.
Great. So just in terms of wrapping up, because I think we only have a few minutes left, hope that you will each take, what you've learned today and any of the insights that you've gained from hearing Kamaria's experience with DTA, to really explore these opportunities and apply them to your own local context. We're going to walk through one resource and a worksheet that each of the project teams will then follow up with, their third sector counterparts to debrief some of the conversation from today. So if we go to the next slide. I know as a starting point, many of the teams are at the point of really, working together to understand the needs of families that they serve and identifying those specific outcome goals that they want to orient their efforts around. and Kamaria talked a bit about that experience at GTA. So this table provides an initial starting point for considering, which child or parent or family outcomes across the various domains that Joelle had mentioned that you may want to focus on. And of course, this isn't comprehensive, but provides some good guiding examples of where you might want to start. This next slide has the worksheet or the activity that will hopefully help you to share the content from today's webinar with your project teams. So this is really to help you organize your ideas about the key strategies and the stakeholders that you might want to engage to advance your young families' efforts. The first step is really to encourage you to start by picking, as an example, one outcome category relevant to either your agency or the program that you're focused on. And then as a second step, really outlining the one or two strategies that Joelle had shared earlier on that can be used to work towards those outcome goals. So whether that be starting with identifying, the measurable goals, whether it means really focusing on developing more family-centered services, or whether your team is really focused first on engaging the young parents or providers for their input and guidance to shape your efforts and your activities. And then that last step there is really identifying the specific local stakeholders relevant to your community that you would want to engage to really support your efforts. And again, the third sector team will be there to help you, think through and review some of the ideas coming out of today's webinar. So with that, I think we're just at time. I want to thank everyone for your time today, for joining us on this webinar. Special thanks again to Kamaria for sharing your experience in Massachusetts with the group. We hope that you've all found this to be a worthwhile conversation. Wish you a wonderful weekend and look forward to being in touch again soon.
Thanks all. Take care.